I don't have a target. We haven't discussed a target internally. Really think that, we want to get as many Americans vaccinated and boosted, get this new COVID shot. I think it is available to everybody over the age of 12. It's going to actually be available to 5 to 11-year-olds soon if FDA looks at some new data and makes its decision. But if we get to an annual COVID vaccine, we really do want broad uptake. If we get that, we are going to make a really big difference in terms of what kind of fall and winter we end up having. What's interesting, Steve, is I've spent a lot of time on the Hill in the last 6 months. And I find when you close the door and there aren't reporters and there's not posturing, there is a remarkable degree of bipartisan consensus, both about the place we are in and where we need to go. That's been my experience. It has not always translated into votes. It has not always translated into action. But we got to keep plugging away at that. It's interesting because I hear lots of chatter about the future of the COVID team and what are you going to do? And I will tell you, those are not conversations that I'm actually having with the president's chief of staff or with the president. The conversations we are having are like, what do we need to drive deaths down? How do we make sure we're better prepared for the winter? What do we need to do to think about as we transition out of the U.S. government buying all of these products, that it's not disruptive, that it doesn't create new financial barriers for Americans. And, when that time comes, there will come a day in the future, because of course, every job ends, when there will not be a need for a COVID response team. But that is I would say it's just not an active conversation, because I feel like we've got a lot of work to do.